My name is Lisa Boss. I'm assistant professor at the UT Health School of Nursing, and I thank you for your interest in the topic that I will talk about today, which is preventing abuse and neglect in the elderly. Our topic today is funded by the Geriatric Education Center project, and it was a HRSA grant, so we are very thankful for that and like to acknowledge that. Your objectives for today are to define elder abuse, neglect, and mistreatment, to identify clinical manifestations of elder abuse and neglect, to describe older adults who are at risk for elder abuse and neglect, to discuss your responsibilities as a healthcare worker if you suspect elder abuse and neglect, and to identify actions that can help prevent elder abuse and neglect. So we'll start with a small introduction about elder mistreatment and neglect. It's estimated that about 1 to 2 million older adults are victims of elder mistreatment or neglect by a caregiver. The experts also predict that by the year 2030, as our older adult population continues to grow, elder mistreatment and neglect will grow as well. Other statistics are that about 1 in 10 elderly people above the age of 65 do experience some form of abuse. But the truth of the matter is that we don't really know how many people are neglected or mistreated because it's very underreported. So even though we think the numbers are high, they're most likely higher than we even know. So a definition of abuse and neglect would be to start with elder mistreatment. Another word for elder mistreatment would be elder abuse or senior abuse, and those are words that you just might see as you read or as you hear about this topic. And the actual definition is a term referring to any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or serious risk of harm to a vulnerable adult. Elder mistreatment. Elderly persons are abused, most often intentionally, although sometimes it is unintentional, and we'll talk about that. It is also a result of ignorance or inexperience on the part of the caregiver, or just a simple inability to care for them, either physically, psychologically, emotionally, or financially. Next, we'll talk about the different types of elder mistreatment. And there are many different types, and they all have different signs and symptoms to talk about as well. So first, we'll just talk about the different types. So physical abuse, that's pretty self-explanatory, and that would involve hitting, punching, slapping, pushing, kicking, restraining, false imprisonment or confinement, or even giving excessive or improper medication to a person. That's typically the most common type of abuse that you might see. And once we talk about the signs and symptoms, it's usually the easiest one to recognize as well. And then we also have psychological or emotional abuse. And that's basically where you humiliate a person. So something common to this type, though, is the abuser or the perpetrator will identify something that matters to the older person, and then they use that to coerce them to do a particular action. So it may be that abuser knows that the older person really loves their pet or their dog. So they might say, well, I'm not going to help you feed your dog unless you do this, or I'm not going to allow you to take the dog to the vet to get care unless you do this. So it's just a form of having them do something that they don't want to do, or holding something above their head with their words. It also may take on other forms such as name-calling, ridiculing, constantly criticizing, accusing them, blaming, or nonverbal forms such as just ignoring them, not speaking to them at all, or shunning them. More examples of emotional or psychological abuse would be mental pain, inflicting anguish or distress to an older person through verbal or nonverbal acts. Okay, sexual abuse. This would be where you force the person to take part in any sexual activity without his or her consent, including forcing them to participate in conversations of a sexual nature against their will. And it also occurs when the person would be no longer able to give consent. So if they had dementia or if they were confused in any way, taking advantage of them sexually at that time. Another form that is pretty common is financial or material abuse or misuse. So this is also known as financial exploitation, and it's the illegal or unauthorized use of someone's property, money, their pension, or other valuables, including their person's will, and changing the name of the will to benefit the abuser. This happens by deception, coercion, misrepresentation, undue influence, or theft. It typically includes fraudulently using or obtaining use of a power of attorney. And then other forms would be to deprive them of money or other property, or by even getting them evicted from their home. So we do see this occur quite frequently, especially when the person is in that stage where maybe they're beginning to become confused. So you know that they're confused, their family knows that they're confused, and maybe they go in and out of it, but it might not be obvious to someone else. So for example, they would say, okay, well, we're gonna go to the bank, and we're gonna have all your accounts changed over to my name. So that person might go along with it because they trust the abuser, and they might not really fully understand what's going on. And then when you go to the bank, the person there might not realize that the person's confused about the situation because they might not show that at that time. And in the same example, that would be where you change their will. You have them do that because they seemingly to the outside world would be able to do that, but you know, or the abuser knows, that they really can't do that. And another example would be a deprivation of rights. And this is also becoming more recognized as a form of elder abuse. This is where you deny the civil and constitutional rights of a person who's old, but not declared by the court to be mentally incapacitated. And like I said, it's becoming increasingly recognized and adopted as a form of elder abuse. And then you also have neglect. So this is where the person would be deprived of food, shelter, clothing, not the proper medical care or attention. Failure by those responsible for the person to provide these to the person. And then you also have another subcategory of neglect, that's self-neglect. And that's where it's the failure of the person to perform essential self-care tasks, and that would ultimately threaten their own health or safety. In terms of describing signs of abuse and neglect, something that you need to understand is that elder mistreatment or abuse and neglect should never happen by either informal or formal caregivers. There really is no situation where it's acceptable or it would be okay for it to happen. And as an informal or a formal caregiver, you are required by law to report any mistreatment or neglect. You are in a unique position to recognize even the subtle signs as you get to know the elderly clients that you have on a very frequent basis, you see them very frequently, you will be able to recognize subtle signs and symptoms that maybe other people wouldn't recognize. I wanted to make sure you understand that it is always better to report something and it turn out to be nothing than not to report it at all. So even that suspicion, a subtle sign and symptom, as long as you're reporting it in good faith and that is what you believe, then there wouldn't be any retaliation against you at all for reporting something that didn't turn out to be actual abuse. But it's always better to report it and let someone else investigate it rather than just let it go. So now we'll talk about the clinical manifestations of elder mistreatment or neglect, and what this is referring to is simply the signs and symptoms. This is what you'll see in your clients. So I'm going to talk about it as it relates to the different types of abuse that we already talked about, and it will include all of these symptoms that are listed on your PowerPoint presentation. So first we'll talk about physical abuse. So what does it look like when someone has been physically abused? So it makes sense to you. They're going to have bruises, scars, sprains, broken bones. It says here on your PowerPoint as well, teeth marks, belt buckle or strap marks. So there'll be obvious or not so obvious physical signs that you can actually see on their body. We talked about before that physical abuse also includes physically restraining them. So for that, you might see they have rope marks on their wrists because maybe they've been tied to a chair or tied to a bed, or they could have broken eyeglasses because they went through a struggle trying to break free from how they were restrained. Emotional abuse is another type of abuse that we spoke about, and it's usually detected by changes in the person's personality or behavior. So they may exhibit behavior that looks like dementia, but it's not dementia. That could be withdrawn, where they don't want to talk to anybody. They're depressed. So again, they don't want to talk to anybody. They appear sad. They might appear very stressed because they're upset about the things that have been said to them. They also might display behavior such as mumbling to themselves or rocking, trying to comfort themselves. So those would be obvious signs that something's wrong. But the other signs might not be so obvious. They could be withdrawn for many reasons, but it's just something that you can pay attention to. And when you see this type of behavior on a regular basis, then it might cue you in that you could maybe talk to them about it and try to figure out what's going on. Financial exploitation is another form of abuse that we spoke about. It is harder to notice because they don't have physical signs typically. But you might hear them talk about significant withdrawals from their accounts at the bank. They might say, oh, I gave $20,000 to so-and-so, which, they can do that. But part of the story, you need to listen to their whole story and listen to all the elements of it to see if it really makes sense to you, that maybe did they really understand what they were doing, or how did they feel about what happened. They might speak of belongings or money that are missing from their home, and they don't know why. There might be unpaid bills that they speak of, or unpaid bills from not only their house bills, but necessary goods or services. So anything that has to do with their home or where they live. Sexual abuse we spoke about, so this is another one that they most likely would be visible signs to their body. So around their breasts or genital area, you might find bruises or scratches or some sort of sign there, swelling. They might have inexplicable infections that are sexually transmitted. They might have bleeding or torn clothing. So those would be red flags for you to think that maybe you could ask them about what's going on. And then neglect. So that's another form that we talked about, and signs and symptoms of that would be malnutrition or dehydration. So they're not eating or drinking enough. You might see that they have lost a lot of weight recently, which could be from many different causes, but it could be from neglect. Poor hygiene. So they're not groomed, their hair's not brushed, they don't have their teeth brushed, they might not have had a bath recently. They might not be dressed appropriately to the weather, so that's something to think about. If it's really cold outside, they should have on proper clothing. They shouldn't wear tank top and shorts and flip-flops. So you can think about that if you see something like that happen, of what's going on exactly. They might not be compliant to their medications, and that might be because they don't have their medications. It might not be that they don't want to take their medications, but in the case of neglect, they don't have their medications. And then also unsafe living conditions. So if you're in their home or you hear them speak of their home, it might be filthy, which is a problem. You know, typically it's not uncommon for homes sometimes of the elderly to be cluttered because they might not have the energy, or they compile things as they go through their life. So clutter is different than filth. So if they're not cleaning anything, that can pose a health problem to them. Also, they do typically have animals, and it might be that the animals are in the house and they're using the bathroom. No one's ever picking that up. So there are some unsafe living conditions related to health that would be a red flag for you as well. So this slide goes with the previous slide, and I already covered the emotional signs and symptoms of abuse. And then there's a little chart right here that shows different faces related to different emotions that you could recognize as well and become familiar with. So I already talked about neglect and how the signs and symptoms of that might present to you. That was primarily in the context of them living at home. Here we look at describing the signs of abuse and neglect, primarily neglect, if it's more of in a assisted living or a nursing home type of situation. So in that case, if they're being neglected by a formal caregiver, then you might see that they have pressure ulcers. So of course that would be that they were lying in the bed for a much too long of time and no one was turning them or helping them get out of bed. They might be unclean. So again, their body hygiene has not been taken care of. That would include hair, teeth, nails, as well as skin. They might have body lice, and of course that would not happen unless it was an extended time period of poor hygiene. Unanswered call lights. So people don't answer their call lights. They're left to lay in the bed or sit in a chair for extended periods of time. They have soiled bedding or incontinence briefs that haven't been changed. Poorly fitting clothing. So typically the elderly do lose weight, and they can lose quite a bit of weight as they get older. So it would be ideal for them to have clothes that fit them better than to wear clothes that are much too big for them all the time. Unmet needs relating to their hearing aids or their eyeglasses, weight loss, poor appetite, uneaten food, dehydration, and the water and the beverages are not being offered regularly. So those would all be signs of neglect from a formal caregiver versus an informal caregiver. So here we talk about the elderly as a vulnerable population to abuse and neglect by caregivers. And when I read this slide and the content on this slide, it really reminds me of the pediatric population as well, and how they're vulnerable to abuse and neglect by caregivers. So advanced age is one reason why they're vulnerable. Just in the same way as the other end of the spectrum, very young age is vulnerable to abuse and neglect. And it's because as they get older, they're weaker overall, in terms of the way they think and the way that they might want to express themselves. They can feel powerless, so when they feel like that, as a part of that aging process, it puts them at risk for being abused or neglected. Also, if they're physically disabled, developmentally disabled, mentally ill, or if they have speech, hearing, or vision impairments, they're at more risk for being abused and neglected by their caregivers. And unfortunately, all of these symptoms or these risk factors encompass a large number of the elderly, so many of them fall into this category. So there are also risk factors that would increase the likelihood that a caregiver would participate in abuse or elder mistreatment. And that would include the reasons that are listed here. So financial and economic reasons, social reasons, family dynamics, poor caregiver health, or cognitive impairment. So if the caregiver is in a situation where they feel overwhelmed or stressed or resentful for any of these reasons, it puts them at risk to take out their emotions or how they feel on that elderly person. If they have a history of substance abuse, or if the caregiver has a history of abusing others, that's just kind of how they deal with things. So in this situation, if they feel stressed or overwhelmed and they have this elderly person, because of the elderly person specifically, they're at risk for abusing them. If they're dependent on the older person for their housing, their finances, and their other needs, they could definitely become abusive. As the elderly get much older and they're no longer working and they're dependent on a very fixed income, then the money available to the caregiver is drastically reduced. And if the caregiver depends on that, you can see how it can cause stress and overwhelming feelings for them, and then that could lead to them to become abusive. If the caregiver has mental health problems, that's a major risk factor. If they're unemployed, so that goes back to the financial reason and for them being dependent on this elderly person. If they have a criminal history, they're certainly at risk for thinking and having a tendency to abuse them or exploit them in any way. And if they're living together. There are also risk factors that put the elderly person at risk to be abused. So these would include factors such as loneliness, isolation, decreased social support, and depression. And these are, or could be, the most important factors because of the way that they're thinking if they fall into this category of loneliness or isolated. So in that case, they feel like they're longing for someone to talk to them. They're longing for human contact, and they might not care, or they might accept it easier if it's bad contact or abusive situations. They're more likely to accept that because they just want to be in touch with somebody. They want to talk to somebody every day. They don't want to be all alone. So they're more likely to accept abusive behavior. If they have poor communication skills, that definitely puts them at risk because they're not able to say their needs or their wants. And that could be just who they are, or that could be because they're developing dementia or depression. If they have physical disabilities, they're more at risk because they may feel like they're more dependent on other people and those other people are abusing them, but they feel like they have to have that or else they can't even live because they need that help. If there is violence in the home, if there's anger and resentment, they're more likely to be involved in abusive behavior and to accept abusive behavior, especially if there's a history of the violence and anger. Then in their minds it could be that this is just a way of life for them. And another risk factor is that they may be scared of healthcare professionals and facilities. So they don't want to go into the hospital. They don't want to go get treatment. They would much rather stay at home. And then as their health worsens, it causes stress on the caregiver, and then they're in a situation where there's more risk for abuse or neglect. There are signs for the caregiver to recognize that there could be an abusive or neglectful situation. And if you notice that the caregiver is stressed and overwhelmed, there are things that you can educate them on how to deal with it. And this also is something else that reminds me of how we deal with pediatric abuse. So when you are stressed, if the caregiver realizes I'm working with my elderly person and I'm upset, I'm stressed, what can I do? Well, I need to understand and realize I'm stressed, and that way I can deal with it. So when they're in that situation, they need to do whatever works for them. So it might be just walking away. It might be that I just need to go take a walk around the block, or I need to go walk to the park and just sit there for a few minutes and clear my head with the fresh air. They also most likely need to get into some sort of group where they can talk about their feelings to other people who are in the same experience. And usually that really helps them to realize, oh, it's not me. You know, it is normal to be stressed and overwhelmed with taking care of this person. So I'm not the only one that feels that way. Other people feel that way. So it's a normal way to feel, but we need to deal with it in a healthy way. And so then you can even learn, okay, I deal with it this way, but so-and-so, they deal with it these other ways and it works for them. So maybe I could try that. So that way you have more than one way to deal with it, and you have options depending on how you feel that day. And then lastly, if nothing helps, call for help. So that would mean your neighbor, having someone, they need to have some sort of support, someone that they can call, whether it's the neighbor, a family member, somebody. So when they just feel desperate, they have that lifeline so that the person, the elderly, doesn't get abused or isn't in a riskful situation. So something that you need to understand and you need to be aware of the proper way to respond to abuse and neglect. And I did speak about this earlier when we said, yes, it is your responsibility and you're required to report it, but what does that mean? So the main thing that you need to know is that it should be immediately reported. So if you really do think that somebody is in an abusive or neglectful situation, you don't want them to stay in that situation any longer than they should or they have to. So you need to immediately report that. If you're working in some sort of institution, whether it's a nursing home or assisted living, then there are channels that you would report that way. So your chain of command, typically based on the organizational policy, but the first step would be to talk to the nurse, and then they typically take it to a doctor, and then up the chain of command through the administration. You could also report it to Adult Protective Services. They do a formal investigation of the situation after you give them all the details, and they handle it. They make it very easy to report to Adult Protective Services. I think in the years past, you had to call and, maybe you were on hold for a long time. It was really a hard process to do. Now they have it where you can just go online and type in all the information and make an online complaint, and it's much easier process than it has been in the year past. Now, if it's an emergency, so it's a very serious situation, then I think they still want you to call. But in that case, they speed the process up for you and for the client, and then it gets taken care of easier and quicker. Because ultimately they need to be removed from the danger. and into a safer environment. And that just might be that they need to stay at the hospital for a short period of time until things can get sorted out and where they need to stay ultimately. And then all formal paid professional caregivers are required to report abuse. And I think most people in this profession want to make sure that their clients are taken care of and in a good situation. So most likely, if you come across something like this, you will want to help the patient and make sure that they're out of the situation. So it shouldn't be something that you're too conflicted about typically. There are ways that caregivers can prevent and stop abuse and neglect, and we can educate them and promote these type of factors for them. So we can help the residents protect themselves from abusive situations by encouraging them to have a social network of friends. And this is very important, and this might be the most important factor for them, to have an outside influence that's positive, and ultimately it's more eyes on the patient or on the client so that more people might be aware of what's going on with them, and then more people might have the opportunity to recognize when there's a problem. And that goes right along with them participating in community activities. So if they're going to church, if that's what they're interested, if they go to church every Sunday or every Wednesday, there's more people then that get to know them and can identify when something's wrong. Also, if they like to play bingo, anything that they like to do, you can help them find that what's available in their community. And typically for the elderly, there's all kinds of activities like bingo and knitting and sewing and dance type of exercise that are on their level. So if you can just figure out what they're interested in, it's not too difficult to find somewhere for them to go to do that on a regular basis, even if it's just once a week. It's also a good idea to encourage them to communicate with people outside the family on a weekly basis. And that goes right along with that being a positive influence from the outside and then more eyes on them. Encouraging them to have personal care appointments like their nails, dental, and hair. It's also a good idea for them to have their own telephones and their own computers so that if they want to communicate with somebody, then they can. That they're not at the mercy of somebody else to have to borrow telephones or computers. You can also give them education on an abuse hotline, and there's typically one in every community where the elderly person can call a hotline if they feel like they need to. And then again, inviting friends over often is a good idea. And here are some references for you if you would like to have some more reading on this topic.